And together, they invite us to deepen our understandings of birth, care, and the many ways people move through these sacred and life-changing moments. Following the panel, participants will be invited into small groups to reflect and share your own birth story. Create a space for connection, healing, and collective wisdom to emerge. How's that sound? Woo! Good? All right, let's get started. So for the first half, we'll do the small group talk with these 4 panelists, and then we're going to break out into the small groups, so you can also reflect on your own birth experience. And then we'll reconvene, share a little bit, and then we'll have one more last storyteller, which is Stephanie. So first, we're going to start with Dal. I'll read a little bit about her. Dal Almeida. Thank you. She's a full-spectrum doula, founder and executive director of Doulas of Diaspora. She's the co-founder, chief community officer of Day Space, Boston's first co-working play space, mom of 3, 2 births at birth center and 1 at home. Can you share your experience of giving birth at home?
Good evening, everybody. Good evening. I'm so excited to be here and just to be able to tell this story in this space. So thank you all for inviting me. I love how you're leaning in. It's giving me the vibes. So as Rosie mentioned, I gave birth at home, and so my husband and I have this running joke that our youngest daughter, Katya, she's still in the bed with us. She's 2 years old. She never slept in a crib, never slept in a bassinet. And we really think it's because she was born on that bed. We could not get her out. So I'm going to tell you a little bit about Katya's birth story. A little context, I gave birth to my first 2 children in Atlanta. I did receive care at Atlanta Birth Center both times. The first time I ended up transferring to a hospital, and my first child was born in the hospital. And my second was a water birth at Atlanta Birth Center. So when it came time for my 3rd pregnancy, I was just getting further and further away from the system. And I knew that the right thing for me to do was to have a home birth. I always wanted a home birth, actually, from the very first time I was pregnant, but because birth center care was covered under my insurance, that was a deciding factor for me at the time to choose to seek my care at a birth center. But when it came to the home birth, and not just the actual birth, but all of the care that I received all of my visits at home. And for anybody who has children or who has worked with young children, I had 2 young toddlers. I was running a doula practice. I was in a position of leadership at a local hospital. And just the comfort of being in my home and not having to worry about driving to Brookline or wherever it is for me to get my care, that in and of itself right there was already a game changer for me and the type of care that I received. Furthermore, I received very just aligned midwifery care, and my visits were sometimes too long. I'm so sorry, Stephanie. Like, I would just be asking her so many questions, and we would just be talking, and we would just get to it. And honestly, we got to know each other as people, and she's become a colleague and a friend of mine till this day. And I just feel like sometimes in other environments, specifically in the hospital or health center settings, even if the providers really want to have that connection with their patients, it's just not possible. There's just too many restrictions and too many limitations and just not enough time, honestly, in that setting. So the fact that I had 1 hour long visits, sometimes 2 hour long visits, even as a doula, even as a 3rd time birthing person, I just couldn't help but think about what and how that would change the experience for somebody who had never given birth before. What if that was the baseline experience? What if that was the introductory experience to perinatal care? And so in my true entrepreneurial, ambitious fashion, I made it a mission after having my home birth to really start to prepare doulas and birth workers to support home birth bring these conversations to places like this and just speak about how incredible home birth can be and eradicate some of the stigma around it and some of the fear around it. And also just communicate the fact that like this is the way that we have historically given birth. What we say is traditional is actually not traditional. Like what we call traditional birth settings and locations is actually not traditional. It's okay, I can vibe to a little background. So I know I only have a few more minutes, so I just want to kind of tell you guys about how the day went when I actually gave birth to Katya. As a doula, you know, we're supposed to be doing all the things to prepare our body and like, you know, be in tune and all that, mile circuit. I didn't do any of that, okay? And then I went past my due date. And I was like, hold on a second. I had a 39-weeker, I had a 39-weeker again. You mean to say I'm gonna go into 41 weeks? Like, what is going on? And I didn't need a clinical induction, right? My body knew what to do, but I was tense, I was stressed, I was doing a lot of stuff, I was managing a lot of things. And so I remember my last home visit before I went into labor, and my midwife was just like, you don't need to do anything. Like, just relax, go for a walk. It's gonna happen. Like, you're fine, you don't need any intervention at this point. There's nothing indicating that anything is wrong. And that is very different from the advice that is given oftentimes in clinical settings. A lot of times, as soon as you get to 40 weeks, like before you can even express what you feel as a birthing person at 40 weeks, there's already conversation about induction and about clinical intervention. So that was very, very different. And that honestly, like, I don't think I had ever told Stephanie that, but that set the tone for my whole labor. I was like, oh, there's no rush, there's nothing wrong with me. My body's gonna do it. I've already done it 2 times before. And so it was just honestly an incredible experience. I did go for a walk, like she said, and then I did go into labor, I think within like a day or 2. So it was just a couple days past 40, which is, again, completely normal. There was nothing wrong with that. And so when I went into labor, I was in denial. But I did call my doula, and she came over, and she was like, okay, you know, let's just see where you are. Because I was like, I think I'm having contractions. I don't know, last time I had an OP baby, and that was like a whole experience for those who are not familiar. I just had like terrible contractions. So I was like, comparatively, I'm like, I don't know what's going on with my body. She came over, and she never left. We were folding laundry. I was just in my house, cleaning, cooking, eating what I wanted to eat. Had family over, and I was truly just vibing with my sister until 4:30 p.m. We were making jokes and everything, and then Katya was born around 8 p.m. So the stage of labor where I was, you know, what I like to say in a different realm was only like 3 hours long. It was so short. We didn't need any intervention, and it just happened. And it honestly was just the most empowering experience of my entire life. So I share this story because I just think it's really important for people to know that this is an option and that this should be the primary option for most birthing people. Some people are high risk and are not, you know, going to fit the criteria for a home birth, and that's okay, and that's why we do have other options. But most people can have this type of birth, and it's really become my mission to let people know that.
So much for sharing that story. That's really powerful. And how you just trusted your body, and it was like no force, no push, just letting things flow. And for you to have that support is so crucial, right? That's why there's a lot of doulas right now in training, and they're out here, right? So that's a beautiful thing. And doula is another option, and mass health pays for doula. A lot of people that don't know that, we're hoping that private insurance will get it together and pay for doulas. But we want to pause and reflect there. Does anyone in the audience have a question or a comment? We'll take about two hands. We don't want to rush. Mary, do you want to give her the mic?
So, thank you so much for your story. I found it very empowering because in this society, if you go back to the Rockefellers and you do your study, you will find out that they changed the whole game in the medical field. Everyone had their babies at home. Everyone knew what to do with the placenta, how the baby still get nutrients from the placenta. It wasn't just clamped off. And when they tell fathers, oh, you can cut the cord, oh my God, they're literally cutting off energy source to their own babies. But that's what they did because the Rockefellers, they're the one that put all that money into the medical field and what the Africans, Native Americans, and the Caribbeans. We didn't need doctors back in the Bible to help me push a baby out, so I applaud you so much for giving birth at home, to trust in your own body, and they sell placenta for like $50,000 or more. They, the Kardashians and them, they put that stuff on their skin to make them have the fountain of youth and all that jazz. That's a whole other topic, but it's amazing to see that the trueness of life and the way we were created to give birth is coming back again. So, for you.
Anyone else? Thank you, Mary.
Great day, beautiful people. My name's Dominique. Kudos to you setting the bar high for your girls and being able to have that support, my dear. Can you just talk to me about nutrition with a midwife? What was those convos like?
Nutrition.
Yes.
Yeah. I mean, I ate the whole time, and it's that simple. Like, I just ate whatever my body felt like I wanted to eat. And most people in labor, like, they're not going to want to eat a huge meal, So I nourished my body, and I'll speak about specifically like postpartum. My doula, I remember she made me a bowl of oatmeal the morning after. And it was the best bowl of oatmeal I've ever had in my life till this day. And just like that, just that personal touch of, coming in and saying like, you need to take care of yourself, and just someone supporting that. But yeah, throughout labor, I ate, I drank juice and water, and I didn't really think about it. It was really a conversation. And that was another reason why I wanted to give birth at home as well, was just being able to truly be in control of my body. And I feel like when you're in your own home, what you say goes. Even if you have a professional there, right, you can receive advice from them, but it's still your home, and there's a sense of power that comes with being in that setting.
One more.
You're doing great.
My name is Doulas. Thank you so much for sharing your story. And also what I like is the connection, the relationship you made with your midwife, your doula, your support team. I really like that part of the work at home.
Thank you, everyone. Thank you again, Val, for sharing the story. Now we're moving on to Amaka. I'm going to mess up this last name, but let me try. Onwuzurike.
Yeah.
Get out of here. I did it, y'all. Woo! I was a little afraid. I will torture someone's name. Amaka is a general OBGYN physician who has been caring for and supporting birthing individuals and families through pregnancy, birth, and postpartum for several years at the Brigham and Women's Hospital. In addition to her clinical role, she also is the Associate Medical Director for Maternal and Infant Health Equity for Mass General Brigham's Health System. She has committed to her career improving maternal health locally and globally, and shares that she feels incredibly honored to be part of the birth experience and carry the stories of so many women and families with children. And she's also an instructor at Harvard Medical School. Can you share, Amaka, can you share, right, yes. Can you share a birth that you supported that was transformative in your career?
Thank you all for the invitation to be here and really just the opportunity to pause and reflect. I think as I thought about what story I was going to share, I thought about the privilege I've had to be a part of so many stories and how those all impacted me as a person, a human, and as a physician and made me better. I'm going to tell you about one of the first patients I cared for when I finished my training as an attending physician. I think about her often and the lessons she taught me throughout her pregnancy and birth. So I met her she was having her second pregnancy. I was going to be taking care of her as her OB. And so I met her at her first prenatal visit in her second pregnancy. It was supposed to be an in-person appointment, and she had an upper respiratory infection, so asked to switch it to a virtual visit. So I was meeting her for the first time and her husband via Zoom. And so I did my usual thing, introduced myself, checked in about how she'd been feeling so far this pregnancy. We talked about her medical history, her prior pregnancy history, and I knew from reviewing her medical, like her chart, that she had a prior preterm birth at 31 weeks in her last pregnancy. And so we talked about that, and I now know, reflecting, we talked about it from a very medical space. We talked about what her risk factors were for that happening again, what were things we might do differently in this pregnancy to monitor her more closely, what interventions we could do to reduce risk of preterm birth. We talked about all of that. Husband, and she listened intently and said things but no thanks. I'm not interested in that. And what we're looking for really is a lower intervention pregnancy care. So how do we achieve that while keeping me and my baby safe? And so that was a moment to pause and really think about that. And we had a really good conversation. We talked about a full spectrum of things we could offer and where they sort of fell on that spectrum of what they wanted to do and what felt comfortable and safe for them. And we landed on, let's do one extra ultrasound in the second trimester. They were not interested in things like progesterone and pregnancy, and we talked about that was okay. And that as we got more information throughout the pregnancy, we'd revisit the conversation and talk about it more. So the next visit was a month later at 16 weeks. She came into the office, had an ultrasound, that extra ultrasound we talked about, everything looked great. And then she opened up more and shared with me a little bit more about that past birth experience and shared that actually just even physically being back in the same hospital where she had that delivery was triggering for her. She was just feeling in her whole body that was triggering all the feelings she had during that birth. And then she told me more about what happened. That she'd come in with symptoms of labor, contracting, pain, discomfort, was in the triage area of the hospital, and felt like she was telling the team that was caring for her that something was going on, and she was ignored and dismissed and spent hours in the triage area and being told, like, you're not really in labor, you're contracting, but you're not in labor. And then finally, at some point, she really was in intense pain, called out to have someone come and check her cervix. She was fully dilated at that point at 31 weeks. She was rushed to a delivery room, very quickly delivered her child. The NICU doctor rushing to the room, and it was just very, as you can imagine, really traumatic. And so she shared all of that with me and said, as I'm sitting here, really all of those feelings are coming back. And I don't know that I can give birth here again. And so we talked about that, and we talked about ways that I could try to support her in this pregnancy differently here, but also that might be true, that maybe we should think about what might be a more appropriate birth setting for you, and sort of talk through some options. And so we made a plan that there was another institution and hospital at a birth center in Boston that she was going to check out and have an appointment with and would let me know how it went. And that if she wanted to transfer care, I was going to support her in doing so. So she had that appointment, decided that made sense for her, transferred care. And then around 20 weeks, her husband actually called, he worked at the hospital, so had my access to my phone number and email and all that stuff. And so reached out to me and shared that his wife had been admitted the night before to another hospital at around 20 weeks, contracting pain, discomfort, and was monitored overnight. Everything looked fine. Ultrasound looked fine. The monitoring was fine. but it just, again, made her really nervous about the possibility of another preterm birth. And at that hospital, they can't care for preterm infants, and so if she were to deliver early, we'd need to have the baby transferred elsewhere. So then we had another conversation around, okay, what makes sense now? What should we do? And I reassured her that she had a very thorough and appropriate evaluation. I agree with everything that had been done overnight, and that I think we just have to closely monitor. And she said, I think I just would feel better being back in the hospital where I work. So she came back and I took care of her the rest of the pregnancy, and thankfully had a really uneventful rest of her pregnancy. Got to term around her due date, probably a little bit after, as you described, we went into labor. And throughout that time, we talked about what would be our plan for her, how to promote and support her in having a low intervention birth, how to have a lot of labor at home, when to come into the hospital, and planning around that. So she went to labor. Her husband called me again, and he shared that she was doing well at home and started having contractions a few hours earlier, but was bleeding. And it's a little bit more than spotting, wasn't really heavy, but just wasn't sure if it was normal and they should come into the hospital. So we talked about that it made sense to come in. So she did, and overall everything was fine. She was in early labor, she was 3 centimeters dilated, her baby looked beautiful on the monitor, it was doing well. She was bleeding, but probably just because her cervix was dilating and opening and nothing dangerous was happening. I happened to be in clinic and was not working on the labor unit, but went up there just to help sort out the plan because she wanted to go home. She said, I have been assessed, nothing dangerous is happening, I'd like to go home. And that's not, as we sort of mentioned earlier, sort of standard for us often as people come in with bleeding, that we're going to want to, often in the hospital, encourage people to stay in the hospital for us to closely monitor. And we really were able, as I went up there, to have a conversation with the team about nothing's wrong, she's just in labor, and her cervix is dilating, she's having a little bit of bleeding, but everything's fine and safe. It's okay for her to go home and come back and she's in more active labor. So I was able to help support her in having that conversation with the team who was on the labor floor. She went home, she came back at 8 or 9 centimeters dilated, and then ultimately had a beautiful vaginal birth. I happened to be in clinics, I wasn't there for the birth, but I came in after I finished seeing patients to check in and see how things went. And she was glowing. Like, she just felt, she used the word, it was magical, was how she described her birth. And it was everything that she wanted, both for her and her husband. She had a healthy baby and just was so grateful for everything that, how everything went. And you could just feel and see the relief and release in her body. The sort of interesting thing is after that, I went to go tell the team, took care of her, I was like, how great her experience was and thank them for helping support her in that. And they were like, that was crazy. Like, it felt chaotic, and it felt like she was in the tub, and she was in the bed, and she was delivered in hands and knees, and then her husband helped with the delivery. And from the care team perspective, that was not how they described it. It was another moment of pause, like how much sometimes as clinicians we see labor and birth so differently from early individuals and families. And how much there can be that sort of the difference there. But I share her story in that she also I took care of her 3rd pregnancy, and she had a home birth with her 3rd, actually. And it was just a moment for me to really think about there were multiple time points over the course of her pregnancy that could have been triggering and reactivating in a really traumatic moment. Early on, when we talked about how we're going to manage you differently, if anything, in this pregnancy, and how do we bridge the gap of like where we're going to land with monitoring, deciding what's the right birthing setting for her, and having that conversation, even if it's not where I work or with me. Navigating coming back into care when it felt like to her that was the right setting for her. Navigating how much labor to do at home versus in the hospital, and then creating in a hospital setting the birth that she wanted, which she then described as magical. And so it just was a nice story in that way, and it also captured that having one really difficult, traumatic birth doesn't have to be your story as it relates to pregnancy and birth going forward. And I think she was able to experience 2 subsequent births that were quite magical as she described them. So I'm sure that. And I learned a lot from that.
Was transformative. You almost had me tearing up again because you told us that story. week, and how when you're held, supported so gently and heard and feel seen, that you can have a totally different experience, right? So thank you so much for your care and the intentionality with taking care of her. Yeah. Any questions or thoughts? Yep, I see some hands going up.
Good.
Good evening, everyone. My name is Indy Almeida, and I wasn't sure whether or not I was going to speak, but I appreciate that 22 years later, there's a doctor like you in the field. So I had 3 miscarriages before I had my son, through IVF. In having my son, I went into post-eclampsia. They ignored me when I went back to the emergency room, and I was stroked out, and I was If I have another child, and I was told, your body can't have any kids, so I had another miscarriage. But the idea to listen to the way you told the story, I'm like, this is great because my son is now 21 years old, he's about to be 22 in age, and he's looking forward to having children, and I said that it will be different. It is okay that you have options, so I just wanted to, it's more like, let me just go ahead and tell the story that it is okay, and that there are doctors out there that look like me, because we're gonna name it, and we don't wanna name it, there are doctors that look like me, that are culturally aware that it is okay to have your baby at home, but it is okay to be listened to, and I know my body better than you, and you could go to school 1,000 years, but I'm telling you that I'm feeling what I'm feeling, and you need to respect that. But I just wanted to say thank you, and you're the second Amaka, I know because my niece is not friend. Her name is Amaka. And I was just like really amazed. She had me tearing up. And I'm just like all shaking and stuff, and I'm like going back to that time. But it is really amazing to just sit here, listen to how you tell that story, and I hope that you have an opportunity to continue telling it in the black and brown neighborhoods so that people understand that there are options for us.
Thank you so much for sharing that amazingness, as it shows. It sounded like you had mentors, because the question is, what made you so intentional? What led you to be at that moment to serve her and her hubby, and being really present for her mentally, physically, and willing to say, hey, go where you need to go? What intentionality? What led you to be, or what took you there?
Yeah, no, I think that's a great question. I think ultimately, as you sort of highlight the importance from a patient perspective, seeing having a doctor that looks like you, a doctor, when I have patients that look like me, there's a different connection there, and I feel different. I always feel responsible for my patients, but there's something added on top of that. I feel responsible for doing my best to ensure that you have a safe birth experience in the way that you want, to the best of my ability. And so there is that responsibility to have the privilege to be in this position, to serve and support, and to really take that really seriously. It's important.
I also just want to mention that the teachable moment was not just so much here for the patient, but for your team, and for them to really learn and observe the experience. I think that's very often we do provide services, but it's about the whole team that's here. That was a great learning experience for them. I think that was empowering and really helped your job, and I think helped them to do a better job on those who are different activities with different. So thank you. I congratulate you.
She taught me a lot. I think about her often as I'm making decisions and taking care of patients. And so as a physician, I learned so much from every patient that I take care of.
Thank you. You know,
just obviously echoing just the gratitude I think everybody in the room has for representation. Not only our owning, but like bringing into your workspace, because I know that we know that all skin folk ain't kinfolk, and I think I've had experiences many of us have down in the Longwood area where people might look like you, but when it comes to lived experience piece, it sounds like that piece you really have brought into your practice. What would you say are some of the barriers for other women of color who might want to come into the field, or like where I'm in the doula fellowship and know we're close to OBGYN, but just curious about your path to OBGYN and how, what inspired you to take it there instead of, any other place where you could have been in the life.
Another good question around, as I keep to reflect back. I think part of it is, I think someone mentioned mentorship, and I've always sought out people that I aspire to be like and who inspired me, and I've been lucky to find in each phase of the process and the training, women who look like me, who inspire me, motivate me, and continue to support me, and then find it my responsibility to reach back and reach forward to others to elevate and do the same. And so that mentorship and teaching is a really important part of my job too. So yeah, I've really sought out those mentors. I've been lucky to have them.
We can't do without the father. We just can't. Right.
You gotta give the brother credit.
Right. We come from mothers, I see grandmothers, sisters, children, we all up in the room here, because we obviously care about maternal health and advancing health equity around maternal health. So we have Dr. Jaykyri Simpson, aka Jay. He is the executive director, I can't see.
You're doing well.
He is the executive director of Young Man with a Plan.
Sweet, I love that.
And his life work is bringing people together and helping young men elevate and access the future they need. He is also a brand new father of a 6-month-old daughter. She's adorable. You showed me the picture earlier. Jaykyri, Jay, can you share your experience supporting your wife during the birth of your child and your journey into fatherhood?
Thank you. Good evening. So I think we got to back up. So I think it was 3 years ago, I met Ariel, and we were invited to be a part of this maternity health equity task force. And I'm like, all right, we don't know nothing about this. I know what maternal means, but the other part, I'm not sure, right? I'm a man, and I think sometimes men are blind. We don't even think about what our wives or significant others are going through and things of that sort. But even before that, let's back up. So 3 years before that, my goddaughter was born. Her father was back there in the back. You guys may know him, and if you don't, you may want to know him. His name is Desmond. And I was just always asking questions about, what was that? How did you do that? What was it like? He would tell me these stories. I was like, oh no, I don't know. So there was a lot of information that I was getting from people that I trusted and cared for. But then I meet Ariel and her team, and they're giving us all this information. I'm looking at the stats. And so being a researcher by trade, I go down these rabbit holes and doing research on women of color and birth rates. And I'm like, oh no, we ain't having no baby. I'm like, I love my wife. She already has other things that she had to battle through. And so for me, I'm scared. I'm so scared. So I'm asking Des probably more often than he thinks. I think he can tell that I was trying to balance in, I want to give my wife the future she wants versus I want my wife in my future. So, and I'm balancing that because I'm thinking in my head, one, I never thought I'd be past 21. Two, I never thought I'd be married. Three, I never thought I'd have a kid. I'm from Dallas, Fort Worth, so I came, even the way we ended up in Boston it's crazy. But anyway. School, college.
That's what made you remain in Boston too?
No. What made me remain in Boston was a beautiful Jamaican woman. We definitely got to extend that.
Yes.
With that said, I think, going through that journey with Ariel and then my team, I was able to kind of do this deep dive in this research. And I'm asking, and we're seeing all these options, And then fortunately for us, we have friends who are also young mothers, so they were having these recent experiences. And so, I'm asking all the questions, I'm creating patterns in my head. You said this, you said this. I'm basically showing a dissertation in my head, chunking the information. I'm like, where are we gonna be at with this? And so every appointment, so when she told me she was pregnant, I would let her tell us, I was like, stop playing, I'm not listening to that. She just showed me, and I was like, I'm not doing there. My dog's there, I'm like that. Say, go take another one, we'll talk tomorrow morning or something like that. Took another one, I just didn't believe it, just because I just didn't believe it. It was not, when the time came and we actually went to the doctor and they showed us what was happening, I turned into a totally different person. And I think I was probably a little bit too protective at times, and she had to tell me to calm down. Because I'm asking questions, and I'm asking these folks, like, what's the likelihood of her staying alive and this baby coming out pregnant? Because I see the stats on black and brown women, and how do I know that you're going to be any different? And then these are things that they're talking to me about. A white woman at that, we're talking. And I was like, can you tell me that she's going to be healthy? I need you to give me the honest information. They're talking about these different markers, at the 20-week marker, that's the big marker, and all these things. And so I'm going through all these classes, I'm listening to folks, I'm looking online for information, I'm trying to reach out to black fathers, but unfortunately I got brothers back home, their fathers dead as well, other folks. I'm just asking them, what was that like? And the whole time, I'm scared. And I think, I was already in therapy, but also having that therapist to vent to and talk about that fear. I'm a black man, well, I'm gonna tell you I'm scared at you. I can tell my wife I'm scared. I can tell her. She better tell nobody. I can tell her. But I'm scared. Like it's the most scared I've ever been, because this is life changing, literally. And here goes nothing. I go on leave, and I'm thinking I'm gonna have my baby at another date. Next thing you know, my wife said, "We gotta go to the doctor." I said, "What?" So we go in there. We get there about 12 p.m. and we're sitting in this room, and they're talking, they're really calm, they're really sweet. We got the music going, we got the vibes, the playlist. We done went through all the classes, so we're owning this hospital space. We're gonna do us, and it's soca music. A little Dallas Fort Worth, but I've come to like soca, walking trophy, and all these other songs. So that's there, creating the vibe. We got the candles lit. We got her mom. Unfortunately for us, her mom is also a doctor, trained in Jamaica, but she's a part of the PAHO, which is, a whole Caribbean thing. So she's mom's mom. And I'm telling her, you got my back if I go crazy. Like, if you're mine here. And in my head, I'm thinking, like, whatever I got to do to ensure the safety of all of this, baby, I will sacrifice that 100 times over. And I'm knowing that going in, so I'm not even worried about that part. But I'm also looking for mom for that direct information. Like, where we going? And so the time comes and she's starting to have this baby. I am shocked. I knew when the baby started growing that men are not nearly as equal to women, because there's no way I'm walking around with something like that. but during this labor, that was the great. That sealed the moment. Like we're not tough enough. I'm not going through that. I can't see that, and to hold her and to see how magical. I was like, oh, she's really. Women are touched by God. This is different. This is totally different. And they deserve more, and I need to be more. So that moment, when they say magic, I don't even think that really describes it, but it empowered me, but more so to let me know, like, women are different. Like, you guys deserve sometimes to go play the role, because there's no men that I know that can go through that for 9 months and then sit out there and let people push, pull, all this. And like, I'm scared. I'm like, not even. Yes! And unfortunately for me, they give me a spot where I can kind of hide and Dan had tried to give me as much information, but when he starts talking a little bit too, I was like, I don't want to hear that. So that said, my baby arrives October 14th, 2025 at 10:38. Healthy baby, mom's healthy. I sacrifice sleep, and I'll sacrifice sleep 30 times over for that and her. And my experience still to this day is like, whew, we did that. The second time, I think my wife was looking for more alternative options, such as home birth or a clinic. She did have a doula. And so, but I think her second child, she was looking at other options. I don't think she would want to go back into a hospital. Not to say our experience was terrible, but I think she has more information and she just feels more confident in the experience. Do I feel confident? No.
You'll be fine.
I do not. I feel helpless in that moment, but I also realize that we're dealing with some superhumans out here. That's women, and that's my most honest experience.
I was leading in like, I saw everybody else in the field like, you know, I mean, thank you for your vulnerability and sharing that. You know, it was joy, but there was also fear.
Yes, for sure.
Going into it, being a new parent, not knowing what to expect, and that Vital Connections gave you some valuable tools to help you navigate that system, the hospital system, but also resources as well. And you had the support system like a doula, your mother on the side, and you were there. You were there present with your wife. That's a beautiful thing. You know, and you don't have to, and you know there's a lot of single mothers here, and you don't have to be married, right? Like, what advice would you give, that's my question, but I was thinking.
Go ahead.
What advice would you give to birthing, because I'm also thinking of birthing people, not just, you know, this non-binary, but, you know, other people having children. Someone's partner, even if they're not in a relationship. What are some ways that they can still be present and supportive to the birthing person?
I would say number one is just listening. I think two women before me has told you, like, you know, listening to patients or somebody listening to them, that goes, I think that's the most imperative. It's like listening to the person carrying the baby, the person that knows their body. And I think you can listen and also give that person as much grace as possible because they're going through something that I don't want to do. And so I think that's the most important advice that I took, even through all the classes, no matter what I learned. I think my most important was listening to my wife's body, understanding that she's much different than any of these women that are displaying in these trainings. And even her mother, who had a pregnancy 36 years ago, my mother X amount of years ago. It's just different. And so I think, you know, listening, and I think that person feels, once they feel heard, they feel empowered to tell you more, like their fears, their hopes, what they also heard in another, you know, women's chat, because they're also looking up research online at the same time. And I think there's sometimes an overload of information that's also scary.
I saw a hand or two up. Feel free, jump in.
We hear you.
Hello?
Yeah, you go.
No, I just wanted to know, young lady, why you in there? The postpartum depression that she had, well, she didn't have it. You know what that looked like. I support that. And even though you're supporting her, how is you getting support? Or how do you support yourself when you got it?
You said therapy. You said therapy, though.
So, the one thing I would say from my observation of postpartum depression is it shows up differently. And what you may read is maybe not how it shows up in your life, but I think understanding there's a couple of things going on. Your wife is not who she was before she has the baby for trauma. Her body's changing. She has to relearn this whole new person. And whatever she's going to go through, I think the best thing that you can do is create a culture where she feels like you are going to listen and she can talk to you. I think fortunately for me, I was already in couples counseling therapy, so we were going to go to that anyway. Maintenance, that's just a thing, to have this safe space to communicate with each other. And I think how I support myself is therapy, and then also trying to continue to create those spaces where I can go work out. But I also have a friend group of fathers that I can lean on, like, hey, did you ever see this in your wife? Did you ever see this in your wife? But then I also come, you know, through those therapies and those avenues, I feel like we created this culture where I can talk to her as directly as possible. Some days, where I'll be like, hey.
Facts,
Are we okay? And then I think she'll tell me, she'll give me the code words. You know, she'll give me code words to where, like, nobody wants to say I'm not feeling good today, or I'm not okay. Because I think when they become a mother, they feel like they have to wear this cape. And for them to say that they're not feeling good, that's like a shot at their armor. Whereas you have to create a code word like green beans, and in her case, saltfish and ackee, you know, something like that, or whatever the case may be. And so that's what works for me in this current moment. And I think I'm still trying to figure that out because I'm only 6 months and a half in, and you know, we can change the information. I'll continue to report back. No, you good.
When we have these conversations, like I got 3 kids of my own, 17 years in, and even though time has passed, 2 mothers, and trying to, so the midwife or whatever you want to call us, run the belly, feed food, pickles and ice cream.
Yep.
It worked, but still, like, the nutrition and nurturing of my kids, and I don't talk to the mother of my kids, I still talk to my kids. Yeah. So we all got different scenarios.
Yes.
Different ages. So I don't want to just sit here and think everything is cookies. No, that's just sweet. No, it's not.
No.
Because there's some other backside, but we just don't get into it. And then too, we don't want to get into it. I want to get into it. How deep we go and go into this, I don't know. Yeah, we can take care of ourselves. It's not good to think of it, breaking down, trying to and making someone you can't make nobody happy. I can be a part of it, but I can't, like you said, the cold words and grow. My sister been married for 31 years, same guy, 2 kids long, she's out of state, but I'm born, raised in Boston, Massachusetts all my life. So we all have different outlooks of what we've seen, how we grew, things we're going to go to, and how we want to take it from here on. So I do know you've got the natural, you've got a kid, and I'm glad that you have the management place. What y'all see? Because there's going to be different avenues, young and old. That we're going to see. How do we take this thing and express it? She gets it, she engaged. Because what we hear and what we cater to is not what women do. So it's 2 different sides of the answer. So but I don't even think anybody's thoughts and their mindset. Thank you for yours.
No, I just wanted to, as a provider, I think you're totally right that even when I talk to my patients, I'm always saying, all right, so what's going on with you as a person giving birth, but also who's your support person, right? Because support people, it could be whoever, right? Like whatever your family function or what it looks like, it could be whoever. So especially, and I'm speaking this in particular for fathers, and I love how you shared your story, is like one of the things I will always tell my patients is, listen, y'all are about to go through some trials and tribulations. It's beautiful, but you're going to go through some trials and tribulations. It's going to be very hard, right? And you got to be able to lean on each other, but you're going to have to know when you say, I need to check out real quick, because it can get really tense. But also the thing too is that postpartum depression, which is not just postpartum. I think it's important to make sure you're calling it perinatal depression, which just means depression even during the pregnancy. You can be depressed during your pregnancy. You can be depressed.
Most of it is before.
Some of it's before, but some people are depressed while they're pregnant, right? So people can be depressed while they're pregnant. They have the baby, they're more depressed, right? So one of the things too is that depression doesn't only just affect that birthing person, but it can affect that family. So there have been times when, like, I will say, like, okay, I know what you need to make sure that you're good, but also I'll look at dad just in that get like, okay, so what's going on with you? Because I know she's not doing well, so how are you navigating that situation as well? So it's true in the sense of, like, how we navigate that period, and as a provider being able to recognize, like, sometimes I will tell some of it, I'm just using women in this context, I've told some of my patients, like, listen, just because it's not your way, just because it's not an A or a B plus, C is still passing, right? So just because the person who's supporting you, and all intents and purposes, I'm just saying if it's the father, remember, it's okay. He got to learn how to be a dad. He has to learn how to, okay, I told you to put the diaper this way, but you want to put it that way, okay. When you have that blowout, you're going to be cleaning it. However, those are lessons that they need to learn. And also, they have to be able to feel supported. So sometimes I will say to someone, I will say, hey, listen,
you gotta let them kind of do their thing, because they're also growing and nurturing and kind of thinking about that too. So just wanted to make sure to add that in.
That was good. That was good.
Thank you for adding that in, Melissa. Just to stay on track of time, we're gonna move on to our next storyteller, Melissa, which she was just speaking, Melissa Nelson. And she is a certified nurse midwife who has worked at Mass General Hospital and Boston Medical Center, and will soon be stepping into a new role as director of APPS at, am I saying it right? Pomelo Care, starting mid-May. She is also currently, she is also currently pursuing her Doctor of Nursing practice with a concentration in executive leadership at the MGH Institute of Health Professions. Look at you. And she's also close partner of Vital Connections and the Maternal Health Initiative. She has joined several maternal health community convos, sharing her expertise and insights on the midwifery model of care, the importance of self-advocacy, and what it means to provide truly patient-centered support. We appreciate all of you guys. Appreciate you, Melissa. Melissa, can you share a birth that you supported that was transformative in your career?
So, thank you so much. I graduate next Saturday. I'm super excited. So, I've always wanted to be a midwife ever since I was a kid. I actually wanted to be an OBGYN, and then I was like, yeah, that's just not my cup of tea. But I love the role that I'm doing. It's actually funny because I do know Dr. Amaka, because I remember her when she was a resident and I was a labor and delivery nurse at her. So seeing the transformation, because they're like little babies and then they grow up and you're like, yes. So for me, when I think about birth, I think one of the things I think that's important is birth is super important, but I think how you're making that person feel during that prenatal care is even more important. So I'm going to talk about two quick stories. The first one is that I was a midwife at Boston Medical Center, and when I left, I was the associate director of the midwifery practice there. And I was also the midwife in the teen clinic, so I took care of all the pregnant teenagers. The youngest I ever saw was 12. So I took care of all the pregnant teenagers. And they were like, we're going to do this centering pregnancy group. And I'm like, okay, what is this? So it's a group prenatal care. So essentially, you would get them all together, and usually you do it month by month. But because of the amount of girls that I had, we made it like my January to March we would all be in one group. And I kind of updated it because you know how the kids are. You gotta make sure that everything's tea and everything's perfect and all of that. So what I loved was that when you and this was a group that I took over, that people were like, they don't come to their appointments. They're not going to be there. You have a high no-show rate, which means that I could be booked fully, but then maybe only 20% of my patients show up. So, I'm Caribbean. My parents are Haitian, first generation born here. So for me, it was more like, okay, well, you're pregnant, but I'm going to still give you, there's going to be still responsibility and accountability. So I had a conversation. So when I walked into the room, people were like, oh, you're my midwife? I'm like, yeah. They're like, you don't sound like this person on the box. I'm like, I know, but I'm a midwife. And they just got so excited, right? So more and more of my patients started to come. So when we did the group, it was essentially like a 2-hour visit that they would have with me and a community health worker, and we'll talk about things. We're checking the heart rate. Partners are able to come. And it was nice because it's like, okay, we're all learning from one another, but they're also learning from themselves. So what I loved about it, in true adolescent fashion, everyone would be like, I don't know you, I don't want to talk, da-da-da-da. But then by the end of it, everybody was like, oh yes, I'm having a baby shower, I want you guys to come. People were, it was really giving that sense of community. And when you're dealing with adolescents, there's a lot of stigma. So me saying no, I do expect you to be at your appointment, I do expect you to be on time, it was like, no, you will be on time, and they were. I always have the rule of thumb. I will see you, even if you had a 9 o'clock appointment, I will still see you at 4:30 as long as you send me a message via our little medical record telling me you're going to be late. Why? Not because I need to, but because you're about to have a child and you need to learn how to be able to communicate and also recognize respect in everyone's time because you have to teach them, right? So all of a sudden they're like, oh, here people come. I said, I know. And when they came, they came. Like I would get phone calls in the middle of the night from some of my coworkers who would be like, listen, your teenager came in, they were asking for you by name, they said you better call her or else. And I'm like, okay. And I'm like, but they knew how to advocate. So like my residents would always say like, yeah, I asked about bringing her back a while. She said, nope, why? Why do you need to? Does this make sense? Like really asking good questions. And a lot of these skill set wasn't just teaching them about their birth, but it was also teaching them about life, right? So what I loved about kind of that experience is giving them that education so that they could learn about each other, right? Giving that education so that half the time they were like, you're the first person that actually sat down and looked at me and talked to me and treated me like I'm a human being, right? You know, sometimes you have to call them out every now and then, but it was all for love, right? It was all for love, but giving them that support and giving them that care and meeting them where they were at and talking about tough situations. So for me, what's transforming was me being able to give prenatal care in a different way than I was taught. And being able to share that, but also learning from them, right? Learning about their experience, how they handle things. One of the conversations in Centering Pregnancy is about domestic violence. And we, you know, it's supposed to be a Dear Abby letter, but you know, they don't like that, so I did a hashtag Dear Abby, right? And we talked about it, and it was so interesting seeing like everybody being like, one girl was like, no, if any of your men did this, call me, I got 6 brothers. And I'm sitting there like, okay, I don't need that right there. But seeing that camaraderie, seeing them being able to talk about those conversations, and also having partners being in that room, right? So seeing young fathers, young individuals coming in together, talking, being like, oh, I could be a part of it. I think one of the best moments was when a father she had her baby, everything was good, and he's talking to one of the guys, the guy's like, yeah, how'd it go? He was like, yo, it was crazy. And he's just getting so excited, he's talking about it. He's like, this is what you're supposed to do, rub her back, do this. And seeing everyone kind of come together was lovely, right? And seeing them advocate for themselves. And in addition to that, so education is key, but something that also was important where it made me realize me being present is just as important was at my last job, there was a father. When I tell you, like, I have never seen someone give so much labor support, rubbing the feet, kissing, feeding. I was sitting there looking at this and I'm like, I was like, your family raised you right, because he was just so into his partner. And so things were not progressing as much, so the recommendation was for a C-section. And all of a sudden he got real quiet, real distant, kind of like not paying attention, like not looking at the eyes when we were trying to talk. And we're prepping and getting his partner ready, and I was just like, that's good, like, what's wrong? And he was just like, I'm scared. And I was just like, what are you scared about? And he was like, my mom almost died with me when I gave birth, and now you're telling me my girl has to go back for a C-section. And it actually stuck with me because I said, oh my gosh. I was like, so seeing him the way he was acting, because the nurse even noticed it, was like, she's like, what's up with him? He's been really fine, like, why is he like this? And, you know, he cried, and he cried right before everything, and he literally was just kind of like, you know, and I gave him the space, and he gave him the space, right? But also realizing and I normally go into the operating room with my patients, I was like, okay, not only am I supporting her, but I need to also support him. And being able to be that individual, because remember, they're that family unit, right? And recognizing sometimes, and some people could have definitely looked at him and be like, oh, it's a 21-year-old black kid doing, you know, not paying attention and playing video games. And it wasn't that, it was just like he would treat it in a way that I was like, something's off, but asking with that level of curiosity. So I think that was something for me of really recognizing sometimes certain behaviors you have to ask why versus thinking that there is a behavior that's happening, but also realizing it's a family unit, right? And like, everyone's not gonna be good if that one person isn't good, but also like, if he's not good, she's not good. And therefore, you know that they're gonna have this baby as well, who may not be good as well, if both of the parents are struggling to navigate all of that. So for me, I think when I think about powerful experiences is the power of knowledge and the power of education, educating others. Because I will always say, I may not be there at your birth, but I'm going to give you the tools and skills that you need to be able to advocate and know how to ask those right questions. But also recognizing that human connection and that relationship is key.
I wish it was my first as a teenage parent myself, and I felt like I had been supported and held and seen, and I didn't know how to advocate for myself. And my experience was so traumatic that I never had any other children after my first.
Wow.
It's crazy.
Wow.
My girls did like to come back. Some of them came back 2-3 times.
I had you all came back 2-3 times.
Like
you know, everybody deserves, you know, as being a young mom, right? Like a teenage mom, there's that stigma, that shame, right? And I really didn't start reflecting on my birth story until I got to Vital Connections.
Wow.
Like, I'm like, oh my God, like I deserve the care and support, no matter what age I was. But again, you don't know what you don't know. And 30 years ago, we wasn't talking about this stuff. Especially teenage moms didn't get the support they needed. So I'm glad we're here now. We're doing the work. No more, you know, we're here all because we all care about maternal health and the outcomes of birthing parents and their children and the whole family, taking a holistic approach. That matters. So, yep. Did someone, yep, go ahead.
Hi. I go back so. So, first of all, I want to say I have a young black 11-year-old child. I'm going to start off by saying he just got to old Brigham, and he was revoked twice for a year now. There's the postpartum things were not treated, but furthermore, when I was pregnant with him, I wasn't getting the services I needed because of my baby stuff. Now, what I really want to say is about what you was talking about with baby daddy, baby mama stuff. Me and my baby daddy did the parenting group at BMC when I was pregnant. I was also in shelter. So I was also going through DP. He's with his dad right now. So the things you're talking about is the only thing that made my son be able to get into O'Brien, regardless of which, not be touched in the system. I'm very grateful for you. The breastfeeding stuff. I actually want to be a midwife and a doula. I'm here by accident. I was gonna come here first and then leave early and then go to the Liz Miranda down the best on here. I was gonna perform. I came here by accident and I'm like,
you're not here by accident.
Yeah. You know what?
You know what I'm saying?
Spiritually on purpose. I'm so grateful for you. And I want you to know I had to have a C-section emergency wise. I wanted a water birth. It was very bad. People like you, women like you, souls like you, I'm so grateful for you because even though things went really a redirection up, you know, but I just got it wrong from up. But if it wasn't for the likes of the lactation specialist, the parenting groups, I've done a lot of parenting groups nationally throughout the time, Mom's Project, all of y'all. Before there was even like legal for natural medicine. I'm so grateful for you. And my son's success right now is turning 12 on Sunday. You know, he was taken away twice. Dr. O'Brien, he's 99 percentile, no diagnosis, IAD, Kirk. Yeah, no, so like, if it wasn't for the likes of you guys, saints. You know, I would get them the shot because back then they couldn't get to school with the shots, but I get a little detox back. That's y'all. Posting on the internet. Okay? Hold on, recipes and remedies on YouTube. What would I do without PBS? I would. Okay, so I just wanted to say a thank you. I also, for the mothers that didn't get you, it's your gruesome. I had to give my son to his dad because I wanted him to be okay. But I did everything you're talking about without the money. So for the mothers that did it all, you know, like I'm not perfect, but I did everything on every article, you know. I would like something for us, like I call it like selling gold to selling oil. Because like coming from street money to legit money because you got a kid, the most gruesome thing I've ever been through is little, you know, the stresses that come when your breast milk is dry out, giving your kid up as Simpson someone's have to a daycare to go to work, because you have to. The maternity leave rate, you know, the way they use dad, you know, his dad got him, but I would love to discuss and nurture a project, not just for the parents and the kids being made, but the other kids. Because they have other kids, I have a responsibility. So for wonderful pillars as yourself, there's a lot of those the areas, the strong people not getting checked on. You know what I'm saying? And the little things we don't talk about, like this funding, like the bridge fund, there's a lot of resources that we don't have access to for us. You know, like it's like Fort Knox to get an email to them, and nobody knows us. But it's all funded through us. Another thing, the funding for the rural areas because of being prone to violence, it goes to the suburbs, I don't like that. We need our money for our babies. And the family resource centers connected to DCF centers for all these babies taken away, they're not telling the people about the resources they got. Tim was right across the street from that. They got everything on the action plan request. So these are things that, you know, I'm very passionate about, and if I had it, you know, maybe I would have had my son during his No Tuesday.
Thank you. This one's on fire. It's a powerful story. I moved, literally. We're not going to do the small breakout groups till, we're not actually going to do the breakout groups. We're going to save the prompts for after Stephanie's Crawford story. So Stephanie, want to join us?
They're waiting on you, girl. That kid's been waiting on you, girl.
Yeah.
Welcome. So glad you're here.
Thank you for joining us, Stephanie Crawford. She is she founded the nonprofit Propa City, which she'll tell you a little bit more about. I was going to read that too, but I wanted to come from you. Propa City Community Outreach in 2021 to support mothers who experience pregnancy and infant loss after the loss of her own son, Simeon. Okay. Through Bella Joe Doula and Family Service, Stephanie also offers doula services and education for family. She does a lot. She's a kindergarten teacher at BPS and getting her PhD at UMass Boston in early childhood. I know, so many doctors on the stage. And she's also the author of My Birth Story. This book, stick around, you're going to get a book at the very end, and she'll talk a little bit about the book. And Stephanie, can you share your experience on losing your son, Simeon, and how that prompted you to found Propa City?
Sure. Hi everyone. So when I was 39 weeks pregnant, I knew that something was different. I felt like my son wasn't moving. And I did all the steps. I called and asked questions, and they told me to come in, and I found out that he didn't have a heartbeat. So depending on how I tell the story, sometimes I'm telling the part where I waited all day, even though I knew something was wrong. Sometimes I'm telling the part where everything was a blur and what that's like for people who are experiencing grief. And sometimes I'm telling that postpartum part where you come out, you leave the hospital, everybody's looking at you like, what are you gonna do now? And you're like, I don't know, go down under my bed if I can, because I don't wanna see anybody. And so going through all of that, there was a lot of decisions that I had to make, and that I didn't even know that something like that could happen to me, and not at 39 weeks pregnant. I thought especially at that time, so it's almost 16 years ago. So there were a lot of, I was told that once he's gonna settle in, and so, if he's not moving as much, that's why, and, there's the safe zone, but they're talking about miscarriage, and there's all these things. And so I didn't even know that something like that could happen to me, and then when I realized that it could, now I have to deliver this baby. So then I get through that, and now I just go home, and it's like, have a good life, maybe have another baby, I don't know, maybe we'll see you later. And so Lynette, who is here, one of my best friends, was with me through that journey, and I talk about this part a lot because this is how Propa City was started. I was sitting on the couch and just feeling like, yeah, this is it for me. And she was like, I know that you're grieving, and I'm here with you. And also, you have to figure out what you're gonna do with the baby's body. They want you to sign these papers. They want you to do these things. And so I was like, all right, fine, I can do it. But I remember looking and saying, we have to do something. This is crazy. I knew I wanted to walk alongside other people. At that time, I just thought, just in that moment, just when they need to make all of these decisions and they are also grieving, somebody can help them do that. And I had this other name for it, and I was like, yes, this is what's gonna happen. I'm gonna do all these things. And obviously with grief, you take your time, and but I went back to work, and I took a job as an infant toddler teacher, which was seems crazy on the outside because of what I went through, and it was only a month or so after. But I love children, I am an early childhood educator, and so that's what I wanted to do. But seeing sleeping babies was really hard for me because that's how I saw my son. So during the time that babies would sleep, I would take my break, and on my break time, I would just research. How do you start a nonprofit? What do you do? How do you help people? Because at that time, I only knew the for-profit side. So that's kind of how Propa City started, just through my grief in this definitely still in a fog, but knowing that I wanted to do something, and I wanted to put this all of this energy that right now is in grief somewhere different. And so Lynette helped me when we started Propa City, and I think, I don't know if there will be another question for me, so I don't want to go too far, but okay. I think that one of the things I thought would happen was, I thought that I would start Propa City and then say, I have it, it's here in this community, and people would say, oh, great, I needed this. And that's not what happened. When I was pregnant, I was visibly pregnant, and I knew, everybody knew I was having a baby. And so after, people would say, how's the baby? Oh, you had the baby. They would ask all these things, and so there's this trying to figure out what to say in that moment. But I also found that when I told people, and often it was women of color, older women of color, they would say, oh yeah, okay. And I'm like, what? I didn't even know that was a thing, and why are you so okay with this? And I was realizing that I lived up the street, here, people were experiencing this. And I didn't know that because no one could find anything for me. And the one place they found for me was the support group in Wayne. So I was driving to Wayne every week just to be in community with people that understood. And so once I realized that, that's what kickstarted me to say, like, yeah, I have to do something. So, so people weren't like, finally a program. People were like, yeah, I kind of pushed that deep down, or yeah, my family said that's where they keep talking about it. I don't want to cry. No, that's okay. Yeah, it sounds really nice, but I can talk to you. And I was like, oh. So I also tell the story, Lynette and I would set up I'm like, maybe we were even here one time. We set up in places and we have snacks and all this stuff, and then we just be there talking about the next plan and eating the snacks because people weren't coming. And so we learned to pivot because we didn't stop. But we learned to pivot and I started to just be more transparent about my story and share my journey of healing. I learned that healing doesn't have a period at the end. It's ever-changing. I'm healing today, even 60 years later. And from that, people would write me and say, I saw what you did and how you celebrated your son, and so I lit a candle for mine. And it's been 3 years, but I decided I want to light a candle. And that's how we got a lot of our community, is people seeing me, share my story, seeing us, like, doing what we're doing, just telling people it doesn't matter, we're here, and being like, because you're gonna know someone, even if anybody in this room, if you don't, now you know me, but if you don't know someone that has experienced loss, you will at some point in your life. You'll meet someone, and you can share, and that's what was happening, is people were able to share. And, that's how our community started to build, and so now we are supporting people, we're supporting families, support people, partners, because I have a lot of family, I have a lot of family, a lot of friends, so many people, and nobody knew what to do to help me, and I didn't know what to say. And so it took me a long time to really learn, and so a lot of the stuff that Lynette and I learned on our journeys, we share with other people so that it doesn't take as long to start that healing process, so that, we can say, I know that feels really tough, this feels really dark, and also you can try this. You can talk to this person. When your family member says that thing that really hurts your feelings, they're probably not doing it on purpose. They really mean well when they say that. So say this, try that. So that's some of the stuff we do just to really support and be there for people.
Stephanie, can you share more about your book that everyone's going to be receiving soon?
Sure. So it was said, but I'm an early childhood education teacher and thought I always would be. And so that's the children's book. I snowballed into maternal health through my loss. And then I had another child who is now 7, and through that I learned about pregnancy after loss and what that journey was like, and that's a whole different process. And I had a doula. I really needed my doula through that. I always tell people for pregnancy after loss, I needed God because I'm a faith-based person. I needed a therapist, and I needed a doula. And my family, the support team that my doula and I built consisted of my family, but I needed that. And so this story talks about my birth with Amani. I am not the only author. Amani also is an author, and if he wants to read it, yes. So this is our story, and we wrote it to share because I took a lot of pride in how intentional I was for this birth. And so, not just for myself, yes, but also with Amani. And he knows about his brother, and I wanted him to know his own story too, because I do this work and because he's always in the back of the room or somewhere near me, he knows Simeon's birth story. And so I wanted him to know his own. And so we looked at pictures all the time, and he had all these questions. And so we wrote this story because other children have questions. But then I learned that not only do other children have questions, we have questions. If you read the book, you'll look and say, I don't know, do I know that? Who cut my cord? Who did this? You know, and so children can read it, adults can read it. It's great for new parents. It's just, you know, it shares our story. And I think it's okay. Can I go to? Thank you. This page, thank you for it. There is a page in the back, thank you. Here in the back, it does talk, it has a disclaimer, but it does talk about Simeon's story as well. Because this is our birth story, and there's space for people to talk about their own birth story, but I wanna make sure I highlight both of my children, but also the different outcomes of birth. And so if someone is, for example, like I am, reading this story to my son Amani, I may also want to explain to him that he had a brother that is now in heaven, and so this is a great way to like start that conversation. And so because I'm an early childhood education teacher, I'm a kindergarten teacher, the book is also written with my expertise in that way, so it is very child. I think you can let me know, but I think it's very kid friendly and gives like definitions and all of that. So
very good, very good.
Question or comment before we transition?
Hi, my name is Robin, and I was wondering, do you think it's a difference between like being pregnant and losing your child or losing the child at 3 months?
Thank you for saying that. So it depends on what you mean. Yes, it's different. We work with families that experience pregnancy or infant loss. So I think what I'll say is when we're working with our families, we're really intentional about how we work, group people and what we're saying and what we're doing. And so if we have a big group of people that are dealing with pregnancy loss at certain stages, and then we have a person who has infant loss, we may check in with them after